This team is here. We do not have a government of one wing, but Norbert Komora and the security team are always with us. And because of that reason, we have a lot of projects in this compound that have collaboration between county and national government. One of them is KMTC, and I've seen Dr. Kelly here. KMTC yetu ambaye tulipata mwaka wa 2014. It is domiciled in Njuki'S University, which is 2 kilometers from here. The students have a lot of problems in coming to this hospital to do their practice. When it's raining, it's worse because they walk most of the time. If they have a session in the morning and one in the afternoon, they have to stay under a tent, and it's a big problem. So we have started doing structures here. I want to report as a government, we have given KMTC total of 5 acres hived out of this land of Njuki'S Hospital. It is just behind here. We started doing a building for tuition block, which is now a 2nd floor, and it was going up to, I think, 5th floor. And we know resources are required to finish that. We are happy because through the directive of the president, which you are already received, we have an agreement that we would like you to make public today, which I do not want to preempt, so that our people will know the future of this KMTC, because they are very particular having those students around here, because those are like our doctors in assisting our human resource, even when they're learning. We also have another block there that's being built by CDF, which is the administration block. I'm not sure that will continue because it is a national government, but we also wish you have a collaboration so that both buildings can be taken over. The other issue that I would like to mention briefly is the issue of human resource in our hospitals. Not only in the Nakhumicha, Madam CS, but even in the Kenya as a whole. We have a very big problem where we have gaps in our hospitals because of having a limited human resource. We have doctors who are trained out there and they have no jobs. So here are 2 parties. One has skills that they need to offer their services, and the one who is supposed to use those skills cannot afford them. So that problem, we need to address it as a team. Your ministry and our county government, the 47 of them, with the committee chair. And the biggest problem, Madam CS, has been resources. We want to hire doctors in this hospital, but we can only afford this much. When we send doctors for study leave, they need replacement. We have no resources to do that. But we have started seeing gaps and places where we can be able to get resources to do that. And one of them is an arrangement where all the funds that are generated by these facilities should be deployed back in these facilities. The Facility Improvement Fund, if it is made operational in all counties, counties will be able to employ more doctors. I want to commit to you, we have already started a program to ensure that by the end of this year, Njuki'S Hospital and all the hospitals in the Nakhumicha County will have all the funds collected from our patient deployed back here. If there is money that is going to go out, it is not going to go out of the hospitals. It is money that maybe that is going to come from other SS departments like roads, like probably market that is supposed to be deployed back to the hospitals, but not the other way. That way we'll be able to employ more doctors. And our last ask, Madam CS, we've seen our transfusion center. We hope that there is more collaboration we can do because we have seen equipment are required. If there's some equipment you can be able to get to give us to boost that. Because we do not want a situation whereby blood tests are taken here, but we have to wait for maybe 2 or 3 days for screening to be done in Embu or Meru, and then the blood come back here. The patients who have been waiting for blood may long be gone. So we'd like to be able to do the screening here and also avail the results within time around here. While walking around, you met patients here who told you that they have come for tests so they can go for cancer treatment in Meru County Oncology. Our ask is that if it will be possible, and we know it is, we'll work with you, we'll look for money to establish a cancer center here in this hospital, because cancer is rampant in our community, as well as the other parts of this thing. And the big, I don't want to say elephant in the room because it's not a problem. It has been a journey. Where we are standing, Madam CS, is where the president, when he was a deputy president, less than 6 months ago, stood here. He opened this hospital, or rather he commissioned the new building, and he gave a promise that once he gets into power, this good work we've done here as a county and the national government of a wonderful facility will not go into waste, because this hospital will be graded to level 5. It has not yet happened, but we are praying that it is work in progress, and we are also hoping that you have good news for us today, because we insisted that you come to see whether we are prepared. We are prepared to be level 5. I know you have a long list that you want us to look at and say this is what requires you to be level 5. Some of them will be beyond what we can afford. We are begging for leniency and mercy. But we are hard-working people, and therefore when we give you a promise that we will attain the standard, we will do it. So give us level 5, and we will ensure that all the other standards that pertain to level 5 will adhere to them. And we pray that it's going to have the quotation, so that our other hospitals like Marimanti and local health centers can now be upgraded to not only level 4 but level 4 plus. So we'd like to thank you very much and give you a promise that the services team being held done here today, even when you give us level 5, it will only continue being better and better and better. I have not introduced my staff, and I will not be able to introduce all of them because of time, but allow me to recognize here we have our Deputy Governor, Honorable Israeli, who is usually in charge when I'm not around. In your presence here today, Madam CS, we have the Hospital Management Board. Are they around? Chairman Mwiti, and Madam Fatuma. The board is represented by Madam Fatuma. We also have the MCAs who are with us today. I already introduced them to you. And one of them is the chair of the committee of health in the county assembly. We also have in our meetings today the Google team, Michael and Mark Matunga, who you would like to recognize. Tupigia Mark na Michael makofi. Ile mtandao inawezesha sisi kuona Marimanti tukiwa hapa na kuona Gatonga ni kwa sababu ya Google. Ile Google huwa mnaona kwa simu yenu. It is an IT company ambaye ina pia peana kwa society, giving back to the society. And thank you very much Michael, because nimeona CS anapenda hiyo technology. Anaweza patia nyinyi kazi ya kufanya Kenya mzima, because it is working. Without further ado, allow me now to invite the CS to address us on all the issues, including KMTC. Dr. Kerry of the KMTC. Do not worry that even if we don't enter KMTC, we'll see it in passing, and Madam CS is well briefed that we need that service around here. Thank you very much and most welcome. Tupigie makofi.
Thank you very much, Your Excellency Governor, your Deputy Governor, the hospital management team led by the board, and the wonderful Dr. Maureen that I have met, who is doing a very good job together with your management team, members of staff and members of the Fourth Estate. Good afternoon. This afternoon, I'm pleased to be here on a working tour upon a directive, as our governor has said, that His Excellency during his campaign made a pronouncement about this hospital, and he toured the facility and he saw that it was a very good facility and needs to be upgraded to level 5. So my working tour today was to check on preparedness if indeed the facility needs the requirements of a level 5, you know, Governor, deciding whether to be level 5 or not is not my directive, so to speak. And even when the head of state has directed, then it's upon us to ensure that we meet the requirements, because it's about standards and it's about what the hospital is able to do for its people. So we have walked around, and there are quite a number of areas that need improvement. You need some equipment, you need some other facilities. For you to be a level 5 hospital, Governor, you have to have a working ICU and HDU, which currently you only have space, yeah? And that can now not qualify you for a level 5. But the good news is that we are going to work together. Since the president has directed, mimi ni mtu wake wa mkono, vile nimeangalia uko na nafasi, therefore it's for me and my team to go and work backwards to ensure that then we bring up this facility to that level. And once we have put in the required equipment, then we'll ask KMPDC to come and do an inspection. Once they ratify and say you're good to go, we tell the president. And since he directed, you and I, we have a very short time to work. Because yeye ni mtu ambaye anasema na anahitaji majibu, anahitaji kuona action. So we have to work together to ensure that we achieve that. The areas that need improvement, they have been outlined. I think we had a prior report. We are going back to the ministry to work on that report and see how we assist you to meet the requirements. But happy also that the places that we have visited, your X-ray department, we have visited your theaters, and we have noted the management equipment services that you have. I have taken note of those that are up and running, and I would like to say that that is the way to go. Unfortunately, we have one that is not working, and therefore for me as a minister is to put the vendor of that machine on notice, because these machines are on placement. You cannot have a machine here for people to be knowing that there is a CT scan, yet they cannot get the scans done. So whoever the vendor is, please know your notice from me. If your contract comes to an end, you'll have trouble explaining why we need to renew it, because you have to make it work for us to be able to renew your contract. So whoever you are, please come to Chuka Hospital, find out what needs to be done, and in future we want vendors who are responsive. We cannot have a machine down for 2-3 months or weeks, because there are people who need services. Therefore, I'll ask them to come and ensure that it is in working condition. Your Excellency, we've seen your blood transfusion facility, and I'm happy to report that upon our discussion, and I have directed that in the first week of March, we will send somebody to verify that the machines that we have donated have been delivered in the first week of March. On top of that, we did come mkono mtupu. We came with a vehicle that we are going to hand over to you from the ministry. And that vehicle is to assist you to be able to move around, and not you, but the blood, the team, so that they can also do active awareness and be able to get donors to come and donate. And where donors have donated, you need to take the blood to Embu for screening, then they're able to do that and bring it back. But for the long term, we'll work together to ensure that then the screening of the blood is done here. On the issue of MTC, I also have a directive from the President that, Your Excellency, we assist you. So today I want to announce before the media is that we have taken over the MTC at Chuka as the national government, and that's why today I'm here with my CEO of MTC. Where is he? Dr. Kelly. So that they see who to hold account. This is the gentleman. So from today, effective today, we take over the MTC, and ours is to ensure that we complete it and we operationalize that in the next few months, we want to see students that they are relocated from there, the university, to here. And they are able to also do their what is it called? Their practicals around the hospital. So Dr. Kelly, kazi kwako. yeah, we will support you to ensure that then we finish that facility up and we operationalize it. Mwisho kabisa ningependa kuambia watu wa Chuka nimewaletea salamu kutoka kwa rais wetu. Mmepokea salamu? Mnampenda? Si aliwaambia atawaletea level 5. Sasa mimi nimekuja kuangalia, tumeongea na governor, tumejua ni wapi tutasaidiana in the next few months mkuwe na level 5. Si namna hiyo? Mimi nitaenda tu kumwambia watu wa Chuka bado wanampenda na wamesema yeye aendelee kufanya kazi mzuri. Si namna hiyo? I think I forgot about the Google services. I must say I'm impressed. It's a good thing that it is helping us to achieve 3 things. One is that skills and expertise can be shared. That mtu wako level ya chini anaweza pata consultation from a senior medical officer. That is a very good thing. 2 is that the patient can get care without travel. And you know, there's a lot of finances involved in travel. You need an ambulance, you know, and all other affiliated services that the person can be able to get care from wherever they are with a consultant sitting here. That is very good. 3 is that we are able to take care and work around the limited human resource, the workforce that we have. That one consultant sitting here can take care of facilities kule mashinani. So mine is to acknowledge you, and I'm told that this was a piloting phase. I have asked my team, I'm here with the Director of Preventive and Promotive Healthcare, Dr. Mulwa, so that then we can have a sit-in between Google, our Ministry of ICT, and ourselves, and we see then how do we pilot this in other places. So thank you very much. And I heard Governor say that he the social corporate responsibilities. Kwa hivyo hata yetu mtatufanyia a few facilities, tuone ikifanya kazi, then we work together. Thank you very much. Governor naomba MRI. I don't want to make a pronouncement and be held accountable for it. But Governor, you are well aware that this government has picked up from a very poor economic status of the country. Therefore, we can only work towards the coming budgeting year, which we have begun working on it. So, together with my team from MOH, is to look at tutatoa wapi pesa hapa na pale. Then we, by the way, for it to be inspected and accredited for level 5, you have to have that MRI. So we'll work together to ensure that in the next budgeting year, we see if we can give you an MRI. And the good thing with technology, still doesn't matter to know, we can have it on placement. Na services ziendelee. Sina mna hiyo? Yeah, so we are going to be very innovative in how we go around these things. Governor, I really like what you've said about ring fencing funds. I'm not sure if together with your county assembly members you've passed the bill, or if you have passed, then well done. We shall work with you to ensure that the funds are, in 2021, well done. We shall work with you to ensure that then the funds are ring-fenced and they are put back to healthcare. Mimi kama waziri wa afya, tunafanya kazi kwa bidii sana. Kuanzia mwezi wa 7, tunataka tuone kila mwana Kenya, every citizen, ako na kadi ya NHIF. Na akienda matibabu hatoi pesa kwa mfuko. Those are the instructions I have from the president, and we are working very hard. Tumepiga mahesabu, actuaries wako kazini, na kufikia mwezi wa 7, I'm sure the president will be making a pronouncement on that. So Governor, thank you very much for your hospitality together with your team. We appreciate, and also appreciate you as the chair of the health committee in the COG, and please talk to the rest of the governors that we must work together to manage a health workforce. You know, without them, then there's nothing we shall be doing. So let's work together on that. And any other places, let's support each other so that we are able to deliver services to Kenyans. Asanteni sana watu wa Tharaka Nithi. Thank you very much.
Yes, asante sana, tuko na furaha sana na sisi kama watu wa Tharaka Nithi, wageni wakitutembelea, hata tukikosa nafasi ya kushare kikombe ya maji, huwa tuna exchange mkono kidogo kidogo. Kwa hivyo tuko na zawadi yako, zawadi ya Bwana Mulwa na zawadi ya Kelly, so that at least you know that you come from Tharaka Nithi. Kwa hivyo ningeomba tufanyie pale ama hapa. Utabeba hii right. So when it's raining, when you visit Rakanidi next time, you have an umbrella from Rakanidi.
Oh, thank you very much.
And I'll buy you back, including something.
This one you don't